It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
All right, our next guest, Dr. Mark Reed, board-certified orthopedic surgeon, foot and ankle guy, who is talking about the fascial foot tear. Shannon, what's that?
Yeah, Tom, the plantar fascia, we've talked about it before.
Mm-hmm.
It's that fibrous piece of tissue that runs from the bottom of your heel to your knuckles of your toe. It supports that longitudinal arch of your foot. And sometimes in traumatic issues, athletics, sports, certain things, it can be torn or stretched, and it's very painful. So we're going to talk about those fascial tears and how to fix them.
All right, Dr. Mark Reed, Shannon O'Kelly on Como.
Dr. Mark Reed, welcome to Health Talk. How are you?
I'm doing great. Thanks for having me.
Well, thanks for joining us again. It's been a little while since we talked. I always appreciate you taking time to join us with your expertise and background. Tell our listeners kind of what your focus is in your practice, your background, kind of the day in the life of Dr. Mark Reed, being a fellowship-trained foot and ankle specialist.
Yes, I work for Orthopedic Specialists of Seattle, which is a pro-Alliance group, and we see patients in Wallingford and Ballard communities. I've been practicing now for about 8.5 years, and as you mentioned, I'm an orthopedic surgeon with additional fellowship training in foot and ankle. My special focus is on injuries involving the foot and ankle in athletes, and my elective practice is just about 100% foot and ankle. So I'm taking care of everything from ankle inversion injuries, ankle instability, cartilage injuries to the ankle joint, Achilles ruptures, Achilles tendonitis, plantar fascia injuries, midfoot and forefoot injuries, bunions, hammer toes, ankle replacements, the works. If it involves a foot and ankle, I take care of it.
Yeah, anything from the knee down, that's your wheelhouse, basically.
Yes, sir.
Whether it's arthritis, an acute injury, repetitive trauma, it doesn't matter. That your expertise is from the knee down with anything that you need to be treated, diagnosed, or some kind of surgical intervention. Is that fair to say?
That's absolutely correct.
Yeah, good. We're going to talk about, you mentioned plantar fascia, and I want to talk about plantar fascia because I think recently one of the Seahawks, I believe, went out of the game, and the suspicion was he tore his fascia. I assume it's the plantar fascia, but tell us about the fascia. Let's set the foot up anatomically regarding plantar fascia.
Sure. The plantar fascia is a thick band of connective tissue, almost looks like a tendon, like the Achilles tendon would look, but it's on the bottom of the foot. It attaches at one end to the heel bone near the back of the foot, and then it extends all the way up to the ball of the foot where it attaches to the metatarsal bones right in front of the toes. And in doing so, it helps hold the shape, the structure of the foot up. It supports the arch when we bear weight, but in doing so, it's susceptible to injuries when we put a lot of stress through it.
And from an anatomical standpoint, you just described it. It's a very important structure because it does maintain the shape or the arch of the foot, the longitudinal arch we call it. So that tissue is going from the heel up to the toes, and it's almost like a sling there, and it shapes that arch. But describe the fascia because it's a little bit different than a tendon, a little bit different than a muscle. It's an interesting tissue. Can you describe the fascia a little bit for us?
Sure, yeah. So, I tell my patients that it does look pretty similar to a tendon, but there's no actual muscle that attaches to it, so it makes it a different structure. And it's a very thick structure that has limited ability to stretch, and that's really where the problem lies, is that if it is stretched too much, it tears. And for most people, they've heard of plantar fasciitis, which is this pain that they develop around the heel. And that happens when the tissue tears on a microscopic level and causes pain because obviously we weight bear through this structure.
And tell me about the blood supply. We talk a lot about healing possibilities in tissue based on the amount of blood supply the tissue has. This fascia, this plantar fascia, does it have a decent blood supply? Okay, tell me about the blood supply there.
Sure, yeah. Certainly where it attaches to the heel, which is where the common micro tears that we see in plantar fasciitis are, the blood supply in that area is very poor, and that's part of why we have trouble healing it, and part of why treatment can take months and months in some cases. Very similar again to a tendon in that the intrinsic blood supply is very poor, and we have trouble getting the healing factors from the body to the site.
More with Dr. Mark Reed and Shannon O'Kelly coming up after this timeout on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
Dr. Mark Reed talking about fascial tears with Shannon O'Kelly as we talk about the foot. And you can get more information at orthopedicspecialistofseattle.com. And here are Shannon and Mark.
Dr. Mark Reed, again, thank you for joining us. What happens if you tear this structure? Talk about tearing it.
Right. So when we talk about tearing it, that can indicate either a lengthwise tear of the tissue, sort of in line with the fibers from the heel towards the toes, or you can have a rupture where the tissue tears from one side of the foot to the other. Thankfully, though, we do get a lot of bleeding into the area, which does help with the healing. And what we've found is almost all of these injuries are successfully treated with a period of rest, immobilization, and gradual return to activity.
In your experience, is it a tear that pulls off of the heel bone? Is it a mid-fascia tear, or are you pulling fibers away from, let's call it the knuckles of the foot, so to speak?
Could be anywhere, but most of the ones that I see are in the mid-arch or slightly towards the heel from there. So they don't tend to be pulling it off of the heel bone or pulling it off of the toe bones. It tends to be more in the middle.
And so in a highly athletic person, are you going to let this heal conservatively, placing it in a boot, immobilize it, let the body do its thing? Or are you going to go in there and surgically intervene to enhance the healing process?
There's certainly been some reports about repairing these, but I think you'll find that the vast surgeon population is going to treat this non-surgically. We have a very good rate at returning patients to their pre-injury status. What we found is a period of time, non-weight bearing on crutches, maybe 2 or 3 weeks, followed by some reintroduction of weight bearing, but still in a boot for 2 or 3 weeks, and then return to activity at that point. And I think our Seahawks player looks like he's going to be on the shorter end of the schedule, thankfully.
Yeah, if you do have to repair it, can you talk about how you do that technically? It seems like a kind of a challenging piece of tissue to me to repair because you have to get the tension in there. That band is so important to maintain that longitudinal arch. As a surgeon, man, you're thinking about a lot of things. Not just the surgery, but also the future.
First of all, you have to decide where to make an incision. We don't like to make many incisions on the bottom of the foot, of course, because they can cause problems in and of themselves. The second is the massive amount of stress that this tissue sees, as you know. So typically it's a suture repair. The suture runs back and forth through the tissue, and then we tie the sutures together on either side of the rupture to pull the connective tissue back together. And then it's a much slower rehab because we really have to count on that tissue healing, and we can't reintroduce extensive activity until we've had that extensive healing, or else the sutures will just all pull out and the surgery will be a failure.
Dr. Reed, thank you for the information. It sounds like, based on our conversation, if you have a small tear or a large tear, the good news is you can get back to activity.
That's absolutely right. Sometimes these take longer than we like, but almost all of them can be treated successfully non-surgically, and you can return to all the things you were doing beforehand.
Thank you for your time.
My pleasure.
Shannon, we've been talking to Dr. Mark Reed about fascial tears, and of course, a lot of people try to be more active at this time of the year. Something like that could easily crop up, and I'm sure you guys have great treatment for those who have something like that.
Yeah, this is one of those things that if you have it, you know you have it, whether you have a tear or whether you just have an inflammation, what we call plantar fasciitis. And yes, Tom, we can treat it. We can get you back moving, get you back to functional activities. It is one of those things that you'll know you have it.
How you feel so far about your productivity this year? We're going to talk to somebody who's a productivity coach, Elise Enriquez, next on Como.